Here's another case. This is Dr. Nemeth points out, and this is a severe case. You see the blue line there is where the gums should be about, and you can see the yellow line as to where the gums have receded to on those two teeth that have receded the most. And this patient had a previously failed graft and wanted that corrected, so Pinhole does work with that. And then the graft was moved up. Also, the red arrows, you see other recession, gum recession on the upper jaw, and those had to be dealt with too. So let's go to our next. Here's Dr. Nemeth. Here's the before and the after. So what do you think of this case, Dr. Chao?
Well, this is an excellent case. It's typical of cases that we see a lot of, and that is severe recession. Sometimes it's even because patient is coming to us because the previous graft has not really taken, or sometimes previous graft was done as a first phase, and then eventually the dentist or periodontist intended to go down there and raise it up. By that time, a lot of the patients feel that they don't want to go through the grafting procedure one more time. So very often we'll get cases like this, and very often we'll get very, very good results, just like Dr. Nemeth.
So what would happen, Dr. Chao, if you look at the yellow arrow there, where that tooth has recessed, again, if the patient did nothing, what is the prognosis for that tooth?
That's that tooth's prospect of being in the mouth for the lifetime of the patient is very much compromised. That tooth is at risk because it's lost so much bone, and it depends on how long the root is. If it gets close to the tip of the root, then the tooth can abscess, and then you have a major infection there, and that can definitely raise the prospect of having to lose that tooth and replacing it with bridge work or implants. So it was done at the right time with the correct result.